Good day, so today I will be performing the Leopolds maneuver. It is the most common and systematic way to determine the position of the baby inside the woman's uterus. It is usually performed after 24 weeks gestation when fetal outlines are already palpated. But before that, we must take note first the nursing considerations we must consider. First, perform the medical hand washing, as hand washing reduces the transmissions of microorganisms. Second, introduce yourself and explain to the patient what is to be done. It is to gain the patient's cooperation. Good day, ma'am. I'm Adrian Alo and I am your student nurse for today. May I know your name, ma'am?
I'm Kelly Junishu po.
Okay, so today I will be performing Leopold's maneuver to determine the presentation and position of your baby. Third, ask the patient to empty her bladder first. Would you like to go to the restroom first? Because it might be uncomfortable for you later during the palpation.
Hindi na po.
Fourth, place the client in a supine position with knees flexed.
Ma'am, angat lang po natin.
Placing the client in a supine position with knee flex promotes relaxation of the abdominal muscles and reduces the stress on the lower back. Then place pillow under the head as it also provides comfort. Then fifth, drape the patient appropriately as it promotes privacy of the patient. And then sixth, warm your hands first by rubbing it together before placing it on the abdomen. It aids comfort because cold hands may stimulate contractions. Then measure first the fundic height. When measuring the fundic height, we must use the centimeters and not the inches. It is measured from the symphysis pubis to the fundus. It is used to determine the size of the uterus used to assess fetal growth and development during pregnancy. For the first 3 maneuvers, stand facing the patient's head. For the first maneuver, it is called fundal grip. It is to determine what part of the fetus is in the fundus. First, stand at the side of the bed facing the head part of the client. Using both hands, palpate the upper abdomen by placing both palms on either side. Locate for fetal parts found in the fundus. If the head is at the fundus, you would feel a hard, round, and movable object. But if it is the buttocks, you will feel a soft and irregular shaped mass that is difficult to move. For the second maneuver, it is called lateral or umbilical grip. It is to determine which side is the fetal back. First, put both hands on either side of the abdomen, applying gentle but deep pressure. It is to determine the fetal position. Then hold one side of the abdomen steady. Palpate the opposite side from top to the lower segment of the abdomen. It is to feel the fetal outline in a slightly circular motion. Fetal back feels smooth, hard, like a resistant plane. Then repeat the same procedure on the opposite side. It is to identify fetal parts correctly. Then, if you already know where is the fetal back, then you can already check and count the fetal heart tone. So, the normal heart rate of the fetus is 120 to 160 beats per minute. In order for you to identify the correct heart rate of the fetus, always remember that it is faster than the maternal heart rate. For the third maneuver, it is called pawlik's grip. It is to determine what part of your baby is in the lower abdomen. With the right hand, using thumb and finger, gently grasp the lower abdomen above the symphysis pubis. It determines the engagement of presenting part. Press in lightly using thumb and finger and make gentle movements from side to side. The presenting part is engaged if it is not movable. If it is firm, it must be the head, but if it feels soft, it could be breech. And lastly, identify correctly the presenting part. For the fourth maneuver, it is used to determine how far does the fetus has descended in the pelvic inlet. Face the client foot part. Place palm on the sides of the abdomen just above the inguinal ligament. It determines degree of flexion of fetal head. Then grasp snugly the lower abdomen with the outstretched thumbs meeting at the umbilical level. A small portion of fetal head can be palpated if it descends deeply. If cephalic prominence or brow of the baby is on the same side of the small fetal parts, the head is flexed. If cephalic prominence is on the same side of the fetal back, the head is extended. Then identify correctly the degree of flexion, position, and station of the presenting part. Then make no unnecessary exposure of the client's body and return to position of comfort. Then lastly, wash your hands.